Dear, let's hear your story.
Okay. I had often had head pain, and I've had CTs, I've had MRIs, and they've always came back totally clean, or it just must be stress, must be anxiety. No answers really ever given besides go home.
But you looked for answers in many places.
Many places. I've been to specialists. I've been to 2 or 3 different specialists. I've been to a neurologist. I've been to psychiatrist. I've been, whenever they've sent me, I've gone to. I've had multiple scans, always come back clean. Same thing, must be stress.
So when you first heard about me, did you think this was voodoo or crazy or anything like this?
No, because I'd already had my jaw manipulated because I get lockjaw, is that the correct term for it? So I've already had to have my jaw physically like shifted and moved, and that was extremely painful, along with the fact that it's closed for like 5-7 days because I didn't know what it was. I was young the first time it happened, and I just figured I hurt myself. I didn't realize I couldn't even open and close it for probably a week. And then after that, it kind of got scary as I got older because there was more pain that would come with it. So all of a sudden it would lock on me, and then it would tighten here, and then my head would hurt, and there'd just be pressure everywhere. But there was never justifiable reason to other doctors. So it got scary at one point. You just kind of start thinking, okay, maybe something is wrong with me in my head.
Well, and you know that it's related to stress. I mean, you experienced that from what you told me about COVID. So it's a short
Definitely.
thing.
I think I've been home, I think 5 or 6 times. I've been tested 6 or 7 times. The first time was 21 days. I have little kids, so obviously every time I'm home, I'm locked in a room worrying about my little kids. And I am married, so I am blessed someone take care of them, but it's still very disheartening when you can't hug your kid.
Right.
And so that's 6 different times for over 10 days that I couldn't love on my children. And that's a nightmare because you're constantly in bed and you're upset. And that's when I grind more and more, because not only do I have TMJ, I grind all the time. So I just sit in my room constantly, just frustrated.
Sure, and you're not alone. So, but you're wearing your appliance right now.
I've been wearing it. I take it out only to eat. I'm pretty good about putting it in. Maybe once or twice I take a break from it for maybe like 30 minutes or an hour.
Good.
And then I'll start to realize I'm shifting on my jaw a lot, and I'll get up and go put it in.
But it also, you had joint noise.
I do. I click. When I open, you could hear the clicking. For me, that always felt like something was shifting. I don't know if that's the case, but it would always just feel so much pressure right here. And mine would go up and then down, and it would even get into the point I was having like neck cramps. And if you've never experienced neck cramps, those are crazy, by the way.
Yeah, they are. They are. So you're wearing your appliance. So show the audience what you're wearing.
Super easy. Just
and it's hard to believe that little piece of plastic allows your jaw to go to a position that's balanced as far as your brain is concerned. And that balance is everybody's body is seeking balance, and that's what you've been seeking balance with your TMJ and your T for how many years? Ever?
Oh, over 20.
Yeah.
I mean,
for a
my
long
first
time.
episode was right after college, so probably 21-ish. I'm in my mid-40s.
And so you have had no headaches since we put the appliance in?
Since I've had the appliance, I have not had any headaches, no. I've had sinuses and allergies, but as far as like where my traditional headaches come from when I grind, I definitely have stayed clear of that.
As you get used to the appliance and learn the ins and outs of the appliance, I can adjust it further, which may help with those slight sinus, because it may not be sinus. I mean, it could, but it may not be. It still may be tied to the TMD.
Okay.
So you know that we're here standing behind you, and that we will get this done, and you already see what a benefit that new position your jaw is taking, how beneficial it is to you.
It is. It's a reminder too, because I think we're not supposed to hold our teeth together all the time.
Right.
And I will tell you, prior to this appliance, anytime you talk to me, I just constantly talked with my mouth shut. So it just helps remind me, and I can tell when it's not right where it needs to be because it hit. So, and that reminds me, okay, little shift. And then everything kind of feels just relaxed.
Right.
And you're okay,
right.
I'm in my happy spot now.
So can I put this on the internet?
Yes, sir.
All right. Thank you.